And it's time to talk about the demand for a diabetic drug. It's increasing, but the reason is tied to its success with weight loss, not treating the disease. The popularity of the medication called Ozempic is causing a shortage of the drug. Dr. Kajal Shah is with Texas Diabetes and joins us now with more. First, welcome.
Thank you.
Thank you for joining us. She's new to the area too, like Grace Thornton, so welcome to Central Texas.
Thank you.
We appreciate your time. Tell us, how did we get here? In other words, what caused the shortage?
Yeah, so the drug in question, Ozempic, which is the brand name for the drug semaglutide, was approved back in 2017 for treatment of type 2 diabetes. It is an excellent medication for treating patients with type 2 diabetes. The way it works is it works on gut hormones.
Okay.
And in response to food, what it does is it increases the insulin production in the body. It decreases the absorption of the food, and it also suppresses the appetite. So overall, because of all these effects, it has a lot of positive effects on the body in terms of controlling blood sugars and some cardiovascular benefits.
Yeah, so the FDA approved the drug for weight loss use last year, and then all of a sudden, boom, everyone's using it for weight loss. What are the challenges with that?
Right, so the drug Ozempic, that was approved essentially for treating patients with diabetes. That is not approved for use for weight loss. Weight loss was a side effect that was noticed in these trials. So, when they observed patients for like about a year or so on this drug, yes, about 5 to 10% weight loss was seen. But the important thing to, keep in mind here is that weight was regained as soon as the medication was stopped. So, although it was the drug was studied for diabetes, yeah, sure, weight loss was a side effect, but it also has a lot of other important and serious side effects which are not being, discussed, or they're not as popular in the media. So, for example, when patients take these medications, it comes in different doses, and the titration needs to be done, very appropriately under constant supervision of a healthcare provider. The side effects could be nausea, vomiting, abdominal pain, diarrhea, feeling really run down. There are some associations with, inflammation of pancreas, especially in somebody who drinks a lot of alcohol or has cholesterol issues, gallbladder disease, and also some association with thyroid cancer. So it does have some really serious side effects which need to be considered before starting this medication.
So this drug is for type 2 diabetes.
Correct.
Those patients, if they can't get Ozempic, what can they do?
Yeah, so last few months we've started getting a lot of calls from our patients that they were not able to get their Ozempic, and in those cases, sometimes we've sent the medication to like a different pharmacy, and that sometimes works. But a lot of times we've had patients to cut down on their doses or even skip the doses, which could be really dangerous for somebody living with type 2 diabetes.
All right, Dr. Shah giving us the lowdown on the shortage of Ozempic. Don't take it if you don't have to, right?
Right.
Thank you for your insight there. All right.